don't operate. Now, here's Dr. Darrow with his co-host, Dr. Thomas Grove.
Hello there, Dr. Thomas Grove. This is Dr. Marc Darrow again, and we're here to bring our audience education on how to save themselves from an unnecessary orthopedic surgery. This is not a put down on surgeons. We actually elevate surgeons because we love the work that they do. We just don't like a lot of the surgeries that they do. And Dr. Grove, can you explain why that is?
So the big challenge that we have in musculoskeletal medicine is trying to figure out where someone's pain generator is coming from. So a lot of times we end up doing surgery just based off of an image, right? Which isn't always a great idea because sometimes the issue is coming from wherever is outside of that image, right? We call that the pathology. What is the read on the radiology report saying, hey, maybe you have a rotator cuff tear in the shoulder, maybe you've got a bulging disc in the back, maybe a meniscus tear in the knee, maybe you have some arthritis in one of these joints. Again, another option we have today is to regenerate that tissue instead of operate on it, right? We can use something called regenerative medicine. At our disposal, we got a couple things nowadays, really advanced treatment, platelet-rich plasma or PRP. Take your blood, spin it down, inject it back in. Or we can use stem cells from something like bone marrow aspiration, take a small needle, go through the back of the pelvis, get some of that bone marrow with platelets. We can spin that down and inject that using ultrasound guidance. Again, those are our eyes. We can actually watch that needle, deliver these cells right on target. But at the end of the day, what we want to do is avoid an unnecessary complication from a surgery. I had a couple tough cases here this week. Again, it's a very typical sort of story. Someone comes in after a couple of failed surgeries, meaning they had some surgeries and symptoms didn't improve. In fact, they maybe get a little bit worse. Maybe they have a complication. So I had a couple individuals who had a few surgeries that unfortunately just were not needed. Their pain generator was way outside of where the operation was. And an individual have a couple of neck surgeries. Unfortunately, they actually had a stroke, if you can believe it, after each one of these neck surgeries. And they kept pointing and said, well, it's kind of like along my back, but really it was along the scapula, right, or that wing bone, where some muscles attach. Again, it's a much, much simpler pathology to go after, right? Little inflammation where that emphasis is, where the muscle attaches to bone. Again, much, much less risky. You don't have to worry about those sort of big risk complications from surgery with what we do with injections.
So, Dr. Grove, here's a real question for you. Do things like, let's say, spinal stenosis, herniated discs, disc bulges, meniscal tears, rotator cuff tears, are those pain generators?
So they certainly can be, but they're not always the pain generator. And like we talk about every week, what's extremely, extremely important is to tease that out with a proper hands-on physical exam. Just because the radiology report says you got something wrong with you does not mean that's where the pain's coming from.
And, this really lines up with all types of medicine. It's not just musculoskeletal medicine. There are too many medications out there. There's too many surgeries out there that really are not for the real cause of what a person has. And I don't care if this is cardiology or rheumatology or any other field. We're just in the field mostly of musculoskeletal medicine. And we see this all day long where people come in with a diagnosis, and we call that the pathology. The doctor has seen something on an image or believes it's something. And then when we do the exam, we find out the cause of the pain, or what we call the pain generator, is nothing to do with that. What's going on here? It's very confusing for patients.
Yeah, it's a very confusing landscape because we all want to know where that pain's coming from, especially when you're in pain. I mean, Doc, both you and I, we've been in plenty of pain in our athletic careers. Yeah. It's not fun. I don't like when people put down someone's experience with pain, right? It's very personal. Some people, it's extremely debilitating. Other people, they kind of, grunt their way through it. But either way, it's not a fun thing to deal with. And we just want answers. We want it to go away, when you're on the patient side of things. And as the physician, right, it's just much easier to treat a lab value with a number or treat an image, that we see on pathology. But the key is we got to get to that, whatever that key pain generator is, and identify it, number one. And then number two, is this something that we can treat with injections as opposed to really going over the top? We think of it like a sledgehammer to fix a small problem, referring to like a big orthopedic surgery.
Yeah. And the nice thing about doing stem cells and platelets is the side effect profile is very minimal when done in very experienced hands like Dr. Grove and I. We probably do the most on the planet. That's what I've been told. I don't know if it's true. We have a very busy practice. I've been doing this 27 years. Dr. Grove's been doing it over a dozen years. And this is basically all we're doing all day long. And this reminds me, when I was a resident at UCLA, I had what I thought was sciatica, right? Mm-hmm. I had a low back pain. I had pain down my leg. And I was limping from patient's room to patient's room. And even though I was starting to do this work, and I'd learned about it during my residency at UCLA, I was thinking about getting surgery because I was terrified. You know, you always hear that if you don't take care of sciatica right away, you can lose the nerve. Mm-hmm. What's the story on that? Is there really such a thing as sciatica, and can we help it?
Yeah, I think there's a couple of, slick terms that are out there that might really put you in a corner as a patient thinking, man, I need to have this surgery, right? So whether it's, things like spinal stenosis or things like disc bulges, right? It's like, well, maybe a nerve's being irritated. Again, most likely it's not, but let's just say that it is, right? Those are just terms that I think, unfortunately, just putting people into a corner feeling that the only thing that they can do is have that surgery. Another, along the same lines there is bone-on-bone arthritis. That's something that we hear every day in the office. That's just simply not true, right? And we get a lot of people who have some arthritis, certainly, but we still get some really good results with regenerative medicine. But bone-on-bone is like end of the road. You have no cartilage. Your range of motion's, gone. You can barely bear weight on a joint. So those are, terms that we don't love to hear because a lot of times it puts the patient in a, all or nothing sort of scenario.
Yeah, I think, this is a bad term, but you'll get the idea. I think patients are seduced into surgery mainly because of lack of education. Mm-hmm. And, if people go to our website, they can really learn the nuts and bolts of what's real in the field of stem cells and platelets. There's a lot of, excuse my French, a lot of BS out there. Mm-hmm. And patients come in and they read all kinds of things that just are not true. Stem cells and platelets are not the panacea for everything. Mm-hmm. You've got to choose your patient wisely and be very educated and very trained to do this work properly. And the nice thing about the work that we do is we use an ultrasound to actually guide the needle. The ultrasound are our eyes. They're our glasses to look inside the body. We can show the patient where the real problem is coming from, and then they can actually see while we're injecting where that needle is going. It's a very sensitive imaging, better than MRI, really. We need MRIs also because the ultrasound only can go so deep it gets blocked by hard objects like bone. So MRI is a good imaging, but it's not always the best, and especially because with MRI, it's overly sensitive, and we can pick up things like we see all the time where we see someone that has a anterior cruciate ligament, ACL ligament tear, and then surgically we go in and we find out it wasn't torn. Mm-hmm. So we have to be very careful. Herniated discs can show up when they're not herniated. We see a lot of things on MRIs that just are not real. I'm not saying not to use them, but ultrasound is a more direct and accurate way to actually look inside the body. We use them in conjunction with each other. So I'm going to give out our website so people can actually watch videos of us doing these procedures, and they can read about this. This is the real stuff. This is, from years and years and years of experience of what is real with stem cells and platelets. It's not like you go down to Mexico or Panama and get an IV of stem cells and fly to Venus after that. Mm. I don't find those things work very well. And we have patients that come up, and you get them all the time also, where there's failures out of the country because these people don't even know where they're injecting or what they're doing, and they're using IV. And, my belief at this point, from what I've seen with the failure of IV stem cells, is they die as soon as they're injected in the body. The body kills them when it's done IV. For us, it's different with musculoskeletal medicine. They actually create new tissue. It's a whole different ballgame. So I'm going to give out the website name, get a pencil, write it down, and go to that. And there's a nice little spot on every page where you can email Dr. Grove or I, and we get back to you every single day. So the website is www.jointrehab.com. That's jointrehab.com. And you can also call us live at the studio right now. We would love to talk to you. We love our callers. You help us educate ourselves with your question, and you help educate the rest of the people listening. So what you do by exposing what your issues are, it can be about yourself or your family or a friend. You can use a fake name. We don't care. And the phone number here right now to talk to us live is 866-870. That's 866-870. 5752, 866-870-5752. I'll repeat it one last time. Write it down. 866-870-5752. And if you'd like to get a free phone consult with our staff, you can call them now too. And that's 800-300-9300. That's our office number. It's 800-300-9300. And for anyone that calls us now at the studio or calls the office or even contacts at the website, we will mail out and we'll pay the postage a free book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. The foreword is by Suzanne Summers, who was a huge proponent of my work. She wrote a few different chapters in her different books. I think she wrote about 20 different books, and I was in a few of them. And she had good luck with my work, and she referred many people to me over the years. We still get referrals from her books, and I've taken care of her and her family. Her child, Bruce, has been with me for many, many years, and he was an avid bicyclist, and he would show up at my house. We were neighbors, and all beat up after falling down, falling off a bicycle. And I would inject him laying on the floor in my house. So he always knew where he can go to get healed up. So anyway, we love the work we do. And Dr. Grove, if you don't mind, I'm going to quiz you with some questions now.
Yeah, well, here, put a pin on that one, Doc. Looks like we got a caller coming in here.
Okay, why don't you grab the caller? We have Don coming in from Castaic, and he's got knee issues. So Dr. Grove, take it.
Don, how are you, sir?
Oh, I'm doing great. How about yourself? Happy New Year.
Doing well. Happy New Year to you. What's going on with the knee?
Well, both of my knees, let me give you a little background. I've been riding motorcycles off-road for probably 50 years. I'm 69 right now, and both of my knees give me problems off and on. They wake me up in the middle of the night hurting, and I get up and walk around a little bit. And I haven't been to the doctor to check them out yet, so I listened to your show, so I thought I'd give you a call.
Yeah, of course. So, 69 years old, statistically, probably have a little arthritis, maybe have some meniscus tears, could be some stretching of some of those supportive structures around that knee.
And by the way, Don, those things that Dr. Grove is talking about are normal. Mm-hmm. They are not pathological. That's normal for age and activity. And most people walking around who have that, and there's tons of us, don't even have any pain. So you got to be careful. What do you got to be careful about?
Yeah, the big idea here is, at your age, active guy, we're going to most likely find these things, but we have to correlate that, right? We got to line that picture up with where your pain's actually coming from. So again, getting you in for a good hands-on physical exam is a great way to tease that out. Plus, it's pretty fun. I'm going to scan you with that ultrasound, and we can actually look at your anatomy together. We can look at the cartilage, those ligaments, the muscles that cross that knee, the joint space as well. See maybe if you have a fluid collection that's in there. When you have knee pain, what area typically do you experience it? Is it kind of all over, the front, the back, middle, outside?
It's more or less on the outside of both knees, and also I have a lot of fluid on the back of the knees. It feels like a soft pillow if I push on it with my finger.
Yeah. Again, that's something most likely, and I don't know because I got to scan you, obviously, but we see a lot of Baker's cysts. That's something for the viewers to check out. Again, it's just a little collection of fluid. I kind of think of it as a spillover from the joint space. So at some point, you probably had, a swollen knee. Sometimes that fluid gets into that Baker's cyst. We kind of think it works in a valve system, so the fluid can get in, but it has a hard time getting out. That's something that we treat very, very frequently. And again, we just use a little needle, again, under ultrasound guidance. We can numb you up, take that fluid out. But again, at the end of the day, we got to get to the bottom of where your symptoms are certainly coming from. But other than that, you're a pretty active guy, walking around, running okay?
Oh, yeah. Now, I'm still working, and at work, I'm always on concrete floors with steel-toe boots, and it seems like that's when it aggravates it. If I'm say off at a park walking on the grass or whatever else, no problems. During vacation, no problems. Mostly it's at work. Concrete floors might be part of it.
So, Don, here's a caveat, something to be watchful for. If you do go to a doctor and they want to aspirate a Baker's cyst on the back of your knee, first of all, you got to be super careful because there are major blood vessels and nerves back there, okay? If it's done without an ultrasound, you're in danger, okay? Just so you know that. Because if someone goes in blind and they hit that, you could actually lose your leg, all right? So we have to be very careful.
Thank you.
Yeah. Now, for people, and you may have this also, like Dr. Grove said, if there is a Baker's cyst or synovial cyst back there, it's often spillover from the front of the knee. So just aspirating the back and getting the fluid out does not solve the problem. The problem is generally the front of the knee. And also, people will come in and go, I've got this huge fluid collection. We call it what are some good names for that, Dr. Grove?
Yeah, like a knee joint effusion.
Effusion is the term that I like, yeah. So you can have a huge effusion, and if you have a doctor that takes the fluid out but does not put in healing cells, that fluid comes right back. And we have patients coming all the time. They say, just drain it for me, doc. I go, I'm not going to do that without a treatment because you're wasting your time. All right, there's no point in doing that. So what we do is, like Dr. Grove said, we numb it up with a tiny needle. We can then put in a bigger needle to aspirate. And the nice thing about the way we do it is with an ultrasound, we can stay away from scraping cartilage or scraping bone. When doctors go, and by the way, it's very painful to get an aspiration by a doctor who is not numbing it up and not using an ultrasound, and he doesn't even know where that needle is. He's assuming. So oftentimes, and the studies show this, and surgery show this also, when someone's been injected blindly, the cartilage has been scaved off. There's actually dents into the cartilage from the needle. So you have to be very careful about choosing your doctor. Unfortunately, most orthopedic surgeons at this point are not trained in ultrasound. And be careful when you have any procedure done with injections. With any doctor, really, make sure they use an ultrasound, especially for the knee, the hip, the shoulder, where it's very, very important to get that needle into the exact spot. Oftentimes, if we're doing, let's say, a low back, we don't necessarily have to use an ultrasound. I know Dr. Grove likes to use it on every injection. My training has been a little different from the old days, where we know that the fluid will traverse fascial planes, so we don't have to get the exact spot in certain areas. But I like the way Dr. Grove does it the best because he is watching every single time that needle is going in.
Yeah, now, a huge takeaway here is that there are some areas of the body that are very, very dangerous to inject blindly without image guidance, and this is one of them. So, again, at the end of the day, we're biased. We want to be conservative and put our patients in the best position to be safe, right, number one, and we want to minimize that harm. And it's an unfortunate reality. A lot of times patients will come in and they have a really poor experience with injections. Again, we call this, bad doctor syndrome, someone who's not using ultrasound. They're digging around with big needles, causing a lot of unnecessary pain, right, and they're not really getting to the bottom of that issue. So it's just something to be aware of.
Another thing is a lot of people are seduced into...
I'm sorry, go ahead.
Some of the people we've had come back have said that a nurse did the procedure without ultrasound. I said, where was the needle put? And they showed me it was not even the spot that was needed to have any effect. Okay. So you got to be careful. Seduction is huge on this planet. There's a lot of illusion. And don't always believe what you read. And I always tell every patient this when I refer to a doctor. I don't care what field it is. Go to the doctor who does the most. Okay? And I've run into that because I had a cardiac ablation a year and a half ago or so. And I had an arrhythmia. And several of my friends had an ablation. It didn't work. And they had it at small medical centers. And I said, when you do this again, because you need to do it or you're going to end up in heart failure, go to the biggest medical center that there is and find the guy that does this all day long. So I'm not saying we're the best on the planet, But I am saying we do this all day long, and we're very confident in what we do. And we're not very confident in these outlying centers where people do this once in a while.
Sounds like going to an auto mechanic.
Like anything.
Yeah,
I don't care what it is.
It could be working on making a model of a car you've never seen before, right? That's really what we're talking about. Is some people claim that they have the training and the experience, and frankly, they just don't, right? So you have to be very careful about where you're going for things like that. But at the end of the day, don't be afraid to ask your provider questions about, how many of these do you do? How comfortable are you with this? What else is going on, right? Don't be afraid to ask those kind of questions.
And we tell our patients, come in with a list of questions. Mm-hmm. And they go, I don't want to bother you with all my questions. And I go, our job is to educate you. We'll spend as much time as you need. And every patient gets our cell phone number. Mm-hmm. We get calls day and night. And I kid people and I say, call me at 3 a.m. It won't bother me because when I'm asleep, I turn my phone off, but I'll call you as soon as I get up if you leave me a message. So we get calls at 10, 11 at night. And I like to shock patients because when I know there's an issue with the patient, I will call them at 10 or 11 at night. And they go, what are you doing? I go, I'm taking care of you. And, I think that's important, that a doctor has a relationship with his patients that goes beyond 9 to 5. And I know, and this happened to me once, I had what I considered a good friend who was a doctor, and I called him on a Sunday. I had a cell phone number. And he said, Mark, call my nurse tomorrow on Monday. I don't work on Sunday. We're not like that. We're there 24/7 for people. And I think that's important with healing on many levels, because healing to me is a spiritual thing. We do the physical part of it, but, have you ever heard of placebo?
Yes.
Okay, what is that? It's hard to know what it is. It works in 30 to 40% of people. So if I could have my practice be placebo-driven, and that might just be me touching a patient's, whatever part of the body, just touching it, there's an energy transfer there. That could be placebo. I'm not saying platelets and stem cells and regenerative medicine are placebo, but there's always a part of that. And I think it's very important for a doctor to be close to his patient so he can impart trust and faith in that patient. So we're here for you.
Very good. Well, thank you. Thanks for the info.
And by the way, if you get images done and you go to a doctor and you find out that you have meniscal tear in your knee and he wants to cut it out, back up. Mm-hmm. I have meniscal tears in my knees. I've injected them with stem cells. I go running almost every single day. I'm on the golf course several times a week. And I am running around pain-free. I still have meniscal tears. They've healed up quite a bit from where they were, but they're not completely healed, but I'm not having pain. My point is, you don't look at what an image tells you to decide if you have pain. And you certainly don't look at an image to decide if you need surgery, unless it's something like a broken bone. That needs surgery. But all these other things, rotator cuff tears, labral tears in the shoulder and the hip, I don't believe in those things, and we heal them without surgery. Also, Dr. Grove was talking about the necessity for ultrasound and dangerous areas in the body, and one of those is the hip joint. Mm-hmm. Because if you're not using an ultrasound that has duplex Doppler on it like ours do, where we can actually watch the flow of fluid so we can find out where the femoral artery is, because when you're injecting the joint, it's just a hair's width away to hit an artery and a nerve, which can kill your leg. So be careful out there, folks.
Very good.
Yeah, be careful.
Thank you, gentlemen.
Thanks so much, Don. I appreciate your call. We're going to a break. Give us a call at the end of the break. We're live and local here, and we want to speak to you, and we'll treat you well. And this is Dr. Marc Darrow with Dr. Thomas Grove, and the phone number here to the studio is 866-870-5752. Give us a call. We'll send you out a free copy of our book, $25 value, Stem Cell and Platelet Therapy, Regenerate, Don't Operate, 200 pages and 256 studies.
You're listening to Living Pain-Free with Dr. Marc Darrow and Dr. Thomas Grove. Their practice is located at the Joint Rehab and Sports Medical Center in West Los Angeles. To schedule an appointment, call 1-800-300 9300. That's 1-800-300-9300. Dr. Darrow and Dr. Grove will be back in just a moment. Stay tuned.